This summer, I worked with Luminous Health, mostly on their diabetes prevention program, which we call DPP. They had a lot of things going on this summer, but this is the initiative that I got most involved in. We did events where we would take a wellness van. So we have this huge bus that has two patient exam rooms on it. We would take it to like health fairs at schools. A lot of them were at churches. And we would take the bus and we would offer free diabetes screenings to those who were interested. The only things we ever did were cholesterol level, glucose level, blood pressure, and A1C. The only two things I wasn't allowed to give or to prick anybody's finger or give anybody any vaccines, because we did do one diabetes event where we handed out the rest of our COVID-19 vaccines. But I did learn how to take blood pressure and also how to run the blood sample through the A1C machine, which was really cool because I've never done anything like that before. And so we would go to these communities, and these were usually communities that needed us to be there because they, a lot of them didn't have primary care providers, or a lot of them were hypertensive, didn't have blood pressure medicine, or were diabetic but didn't know how to handle their diabetes. So that was really rewarding because we would go out there and screen people and educate people, and everybody was really grateful. And we did this a lot, multiple times a week. We also held our diabetes prevention classes. We had an English cohort on Zoom and a Spanish cohort in person, and I would usually attend both. I ended up liking the Spanish cohort better just because it was nice to be there in person with the women. It was all women course. Two of them were pregnant, which was really cool to watch because, throughout the summer, it was awesome. And we would do Zumba. We would record their physical activity. We would get what food they like fast food, and help them modify it to be healthier. We would do my plate activities. And that was usually PowerPoint. And I couldn't understand anything, honestly. I learned to sort of I can understand keywords, but it was definitely frustrating not being able to communicate with these women. So that was one takeaway of the summer, was that I should definitely learn some Spanish. I did a lot of other little projects too. I worked on a food game for children. I helped with some research. I input all the data from the Spanish DPP into Excel, which they're going to keep doing after I leave. I helped with the planning for fall DPP classes. But it was a very rewarding experience. And I think that the most impactful thing that I learned was I really got to see close up the health disparities that are in my community, where I grew up, which was really interesting. And, not everybody's the same. Not everybody has the same access to healthcare that I have. And I knew this before, but it was really eye-opening to see that firsthand and talk to these people that were coming on the wellness van, getting screened, and hadn't had their A1C checked in years. And it was really rewarding. And I would definitely recommend this company to future students at UT. The only problem is that it is based in Maryland. It's not throughout the U.S. But if any student was ever from Maryland and wanted to be here, I would definitely recommend it. They have other options too. They do clinical psychology, hours and stuff like that. So it's not just public health. They have a lot of options for people. But it was great, and I'm really glad that I did it. So, yeah.